Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Dr. Val Farmer, a clinical psychologist in Wildwood, and Jason Medows, a pharmacist and cattle rancher from Rolla. They spoke about the stigma surrounding mental health in rural communities and how they are working to dissolve that stigma. Here's Val.
I did a lot of training in the 80s with ag mediators because they were really on the front lines. They could see people that were depressed, and they needed to know the resources. They needed to be comfortable with making good referrals. And so the people on the front lines aren't necessarily the mental health professionals. There's a lot of other people. There's
right.
Addiction recovery people that can also be in the loop. There's a lot of people that really see these people before the mental health professionals.
And there's financial constraints to going to see the mental health people, the professionals too.
Mm-hmm.
You have to pay to go. Some of these people, you're seeing them anyway. The seed dealer or the vet, you're spending money with them, but they're already going to be there. So that's just not another trip that they would have to go to see someone. And another thing I think is sometimes people just aren't self-aware of what's going on, and people are able to pick up on cues. And so maybe people recognize that someone's having an issue before they even know. I
think one of the things that's happening is that they're training health clinic people like nurse practitioners. Sometimes there's basic family practice or other professionals that are at front lines, and they are teaching them how to give good mental status, and they really are not afraid to open up that avenue in their assessments, and they actually encourage that in a rural community to really not be afraid to go in that arena and do it with some confidence.
One thing I know that's happening in our health system is we have a clinical psychologist who he's actually a friend of mine. He specializes in rural mental health, much the same as you. But his office is actually in an internal medicine suite in our medical office building. So the people who go to see him, they don't have to go to a different special mental health office or a psychology center. So that kind of, I think that's a bit, he calls himself a behavioral health psychologist. And I think that's another good way to break down some stigma, break down some barriers to getting treatment.
When I started in this work, mental health was the only word, and somewhere along the way around 2000, they started calling it behavioral health, and that there's certain behaviors that you can change that will really make a big difference. And it's a little easier term to swallow than mental health.
Right, I agree. Mental health has some negative connotations associated with it, whereas behavioral is it's neutral. It's neither good nor it's bad. It just is, So and mental health really isn't either. But like you said, we have that stigma associated with it.
That was Jason Medows and Dr. Val Farmer speaking about how everyone can do their part to help their community members maintain good mental health. That's it for this week's Missouri Health Talks, which was reported and produced by Will Robinson. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.